Welcome to the online demonstration of interventional radiology procedures for pain management. Valley radiologists offer a variety of procedures for pain management. This demo will explain these procedures and the most common reasons why they are performed. Part 1. Back and neck pain. Injection techniques can be used in every major joint and in many small joints in the body for either diagnostic or therapeutic reasons. These include identifying sources of pain, providing pain relief, obtaining fluid samples, and delivering steroids to reduce inflammation. All injections are performed under CT or fluoroscopic guidance by specially trained interventional radiologists. Back pain affects many people. There are a variety of spinal procedures that can relieve or help to precisely identify the source of pain. Epidural steroid injections. Epidural steroid injections, ESIs, are performed for relief of low back pain, which is often associated with leg or buttock pain. The epidural space is a space which houses the sac of fluid which contains the spinal cord and many nerves in the back. The ESI distributes medication to this space, where it can have an effect on several nerves and disc margins in the lower spine simultaneously. These injections can often be directed to the specific location felt to be the most likely source of symptoms. These injections may be repeated in a series of 3 every 6 months if necessary to obtain maximum relief and benefit. Facet blocks. The facet joints are small joints on either side of each vertebral body in the spine. Facet pain is neck or back pain that is usually made worse by twisting or bending, which can cause friction or tension on these joints. The area is typically painful if it is pressed. The pain often radiates or spreads out from the back or neck. For example, pain may extend from the lower back to the hips or legs. A facet block is an injection of an anesthetic which can be used to help determine whether these joints are the source of pain. If positive, further interventions can be indicated, including steroid injections to these joints to reduce inflammation and pain, and rhizotomy or denervation of these joints. If steroid injections are performed, they may be done in a series of 3 every 6 months to achieve maximum relief and benefit. Select nerve root block. Nerve root blocks, or NRBs, are performed to relieve pain in the neck, back, arms, or legs, and to confirm whether one's pain and/or numbness arises from irritation of a particular nerve. The nerve root is the part of the nerve that emerges through an opening in the side of the spinal column, between the vertebral bodies. If the root of the nerve becomes irritated, the area of the body serviced by that nerve may experience sensations of pain and/or numbness. An NRB is an injection of anesthetic and a steroid medication to reduce inflammation deposited precisely at the site of the nerve root. This can reduce the inflammation and irritation along this nerve, often resulting in pain relief. These injections may be performed in a series of 3 every 6 months if necessary to achieve maximum relief and benefit. Sacroiliac joint or SI injection. The SI joints are long joints in the lower back where the pelvis joins with the lower spine. If these joints become irritated, they may cause pain in the low back, buttocks, abdomen, groin, and/or legs. An SI joint injection can be both diagnostic and therapeutic. An anesthetic or numbing medication is injected directly in the joint. This can induce temporary but immediate pain relief if the SI joint is causing the experienced pain. When injected with a steroid medication to reduce inflammation, which often causes pain, this can provide additional longer-term pain relief. These injections may be performed in a series of 3 every 6 months if necessary to achieve maximum relief and benefit. Preparation. For most types of spinal procedures previously discussed, the patient is placed on his or her stomach. Imaging is used to identify a skin site overlying the affected area. This skin site is then marked and the surrounding area is cleansed with antiseptic solution and injected with a local anesthetic to numb the skin surface. A skinny needle is then passed to the appropriate location, a joint, nerve root, or epidural space in the spine, using direct imaging guidance, often CT or fluoroscopy. Once that needle is in the correct position, injections are performed. It is common to briefly experience the typical pain and to feel some transient pressure or mild discomfort during the injection. The procedures typically take between a half hour and an hour to complete. Normal activity may be resumed following any of these procedures, though it is important not to do too much too quickly or overexert oneself, even though typical pain may be absent or much reduced. Please note, the use of steroid medications can slightly elevate blood sugar levels for several days following an injection. If diabetic, please consult with your physician for how to assist in the management of this condition and adjust to these changes. Following these procedures, please call and report any fever or acutely worsening pain. Brief periods of weakness or numbness immediately following a procedure are often the result of the anesthetic used affecting adjacent nerves. Please inform the X-ray staff if you've had reactions to X-ray contrast and of any other allergies and current medications. Part 2. Compression fractures. Treating compression fractures. A vertebral compression fracture occurs when one of the bones in the spinal column, the vertebrae, weakens and collapses. The weakening of these vertebrae can be caused by osteoporosis, which is a condition wherein the inner structure of the bone becomes thinner and more porous, and thus increasingly fragile. Even minor trauma, when combined with the weakened bones in the spine, can cause the vertebral body to collapse, which can be very painful. When conservative treatment, pain medication, bed rest, a brace, does not work, or the pain is severe and debilitating, vertebroplasty or kyphoplasty can be performed to treat these compression fractures.